Hello, everybody. Hope you're all having a good day so far. I am Tammy Evans. I'm a co-owner of Cetus Media Group. We're a digital marketing agency and have been around since 2004, so it's a long time. Don't do the math. It's just not right. Anyway, as you all know, consumers use online resources to make buying decisions. Everybody knows that. And the thing is, what they see online is what they think of you. And it doesn't make any difference if it's true or not. So what do you do about that? The bottom line is that your digital reputation is critical to your practice success and importantly, your revenue. So we have an incredible group of panelists here, and they're going to discuss, easy for me to say, they're going to discuss how to achieve digital marketing success. And so I'm going to let them introduce themselves, and we'll get at it.
I'm Jason Whitmore. Hi. I work for Cetus Media Group.
I'm Aaron Carpenter with Mental Health Marketing Creative Agency, not to be confused with the Mental Health Marketing Conference, although some of you have asked me where the bathrooms are, and I have helped you out.
Did he offer to buy your URL? I'm Jeremy Armstrong. I'm the CEO of Might Recovery Marketing, and if you call it Mighty Recovery Marketing, that's fine, and I'll have to change my name after this conference because about 10 people have already done that, so that's all right, but Might Recovery Marketing. So.
Okay, let's get started with the first question. So, Aaron, how do you identify your ideal client?
Yeah, so this is one of the first things that I had to tackle when I started working with mental health clinicians. I've been working with clinicians for over 10 years. We got started when we linked up with Joe Sanek of the Practice of the Practice podcast. Anybody hear that podcast? Yeah, some. If you haven't, it's a great podcast around the business of running a private practice. So still the same brand, they're a sponsor. You can see the logo up there, still the same logo uses today. But the main challenge that I found when I worked with clinicians was that they're very inclusive, which is great. It's an admirable quality. But when your website and your content speaks to everybody, it speaks to nobody. It doesn't resonate with anyone. The inclusivity is really important, but identifying who you do your best work with and then making it clear that you do that and you don't hide from them behind trying to be so inclusive, that's really the main magic. So I think we cracked the code on that, and we developed a process where we just have you fill out a few questions and we build you an ideal client persona that we review with you so that it helps as an instrument to be the work that you build towards, not necessarily the only work that you take.
What marketing methods work best to get clients interested in therapy?
So kind of ties in, but I would say websites are something that I see frequently overlooked. But what's the first thing you do when you're trying to find a professional service? Search for it and you look at their site, right? And if you're doing in-person therapy and you have an office, you probably have a pretty nice office. It's decorated nicely. You want to create an environment that activity occurs in. Your website is very similar, you know. I talk with a lot of clinicians who've been in practice for 10 plus years. They're in small group practice with 10 clinicians or large group practices, multiple locations, clients of ours. The number one thing they say when I do customer development interviews with them is, man, I really wish I had invested in a professional logo and website a lot sooner. That would have upped my game. The question that I ask, by the way, it's one of my favorite questions to ask clients. I'll go, if you could go back in time and talk to yourself when you first started your business, what number one piece of advice would you give yourself to grow your practice more effectively? That's the easily the most frequent answer that I get. So when I'm doing those customer development interviews, I also ask them what marketing methods that they feel are most effective. The answers are pretty unique and different at the small practice level, but at the large group practice level, the answer is always the same. Nothing beats traditional marketing still. Local referral networking building. So we developed a program where out of that ideal client persona, we designed two-sided rack cards that speak directly to that ideal client persona. Then we look for all the locations in your immediate area where that ideal client persona would frequent. And we create a spreadsheet of all those locations so that you, with a therapist introduction letter or a clinician introduction letter, can go out, introduce yourself, give your printed material, track when you set up that relationship, and frequently follow up and say, hey, I did get your 2 referrals. Treatment's going very well, thank you. By the way, do you still have printed material there? Do you need me to bring any more? We equip all of our clients with that while we go to work on the digital side and do everything that we've been talking about earlier, making sure that the SEO foundations are there, making sure that the content speaks to the ideal client.
We're going to move on to money here. How do you know how much to spend in marketing?
Yeah, how I solved this. So my original creative agency is Legendary Lion Creative Agency. We worked with clinicians, like I said, over 10 years before I made a more formal offering through Mental Health Marketing Creative Agency. And in doing that bespoke, custom creative work for all different kinds of projects across industries, the main problem I was trying to solve was, man, it would just be so much easier to do my job if clients came to my office and said, Aaron, I got 10 grand, what can you do for me? But that's not how it works in my line of work. How it works is we go through discovery, I ask you lots of questions, I build a list of features and a sitemap, and then I give you a quote, and I cross my fingers and hope that that works for you. And some other agencies approach it where they give tiered packages, but I just really disliked all of those methods as I was building my business because nothing ever felt like the fit for a client, you know? So I started to figure this problem out, and this is what we take every client through now in our second sales call. The Small Business Administration recommends that businesses that are doing under $10 million a year and over 10% in profit margin spend 10% of their annual revenue on marketing for B2C, okay? So it's a really easy figure to make. Think about how much your practice makes per year, move the decimal over 1 point, that's how much you should be spending on marketing. Divide that by 12, that's your monthly marketing budget. But that's for all marketing. And some of you may belong to the Chamber of Commerce or do printed materials or whatever. You belong to directories, which you should belong on all the directories if you're trying to land clients because the ROI on that is insane. 30 bucks a month, you land one client worth 1,200, you get one client every 3 years. It's
Psychology today.
yeah. So what we typically recommend is if you're strictly doing telehealth, 75% of your total marketing budget should probably be spent online. Because if someone searches for you in their moment of crisis and they don't find you, what's the point, right? So with that budget, we work with clients, and then once we figure out a monthly marketing budget for a practice, we have a set of skills and services. It's just a question of how quickly we can roll that out for you. So that's our recommendation. So every offer that we give a private practice is kind of riffing off of needs assessment and sliding scale a little bit. We figure out what you need, we figure out what the monthly budget is, and then we figure out how quickly we can deliver that. But that hopefully answers the question. It's one of the first things we try to answer for everybody, how much should I even be spending on marketing? That's how much you should be spending on marketing.
Thank you. That is a great formula to use. I like it. A few more questions here, but I think the best thing to do, I'll start with you, Aaron, if that's all right. What else would you like to add based on what anybody else has said and you haven't covered
closing
yet?
remarks. That sounds nice. Nice way to finish it off, eh? Number one piece of advice I could give all y'all from, oh no, there's the Charleston coming out. I'm from Michigan, but I've been in Charleston for 8 years, and I just let a y'all come out. Wow.
All y'all.
Best advice I can give y'all is that the clients that I see the most successful, that are really thriving in practice, they don't hide. Right, they own here's who I do my best work with. And almost inevitably you see this evolution, two evolutions, I suppose. One is therapists that just get credentialed and they get started in the practice, or mental health clinicians in general, want to help everybody, which is admirable. But what ends up happening is they identify that they do really good work with a specific type of person, and they become a specialist. And once you do that, your average number of sessions goes up, the amount that you can charge goes up. The sales closure rate of people that are calling you goes up because they're the right people getting connected with the right person. And that's what we do. We help the right people get connected with the right people. A good marketer should always be about that, especially in this space, because it changes everything. It changes how often they see you, how good the work is, all that. So don't hide. Own who you do your best work with. If you're already working with a marketing agency, awesome. Lean into when they ask you questions about getting specific. The way that we approach marketing is that we don't market a practice. We market the clinicians. So if you have a group practice with 30 people, we have 30 different plans of how to connect that person with other people, okay? So don't hide. That would be my major thing. There's a couple of things I'm really pumped to offer as a promo. So if you go to mentalhealthmarketing.com/promo, or if you see me at the back table, In the next month, we're going to be launching the private practice directory. Some of you, I'm curious, by a show of hands, how many of you have heard of the online counseling directory? Anybody? No? This was a really big project before COVID hit. Clay Cockrell and I were working out of it, and it was an international directory for doing therapy online, where we were providing resources and had a whole directory. Anyway, I built a SEO-optimized private practice directory, and I'm offering everybody free profiles on that. So if you let me know, I'll get you that information. We're not launched yet, but we can get all your profiles built, and it's already SEO optimized, so you rank in your area for your specialty based on everything I talked about. We also have the private practice planner. It's a business plan from solo practice to small group practice to group practice, multiple location. Everything that I learned working with clients over the past 10 years is in there. It's free. I'm offering it to you guys as an offer of goodwill and to share the experience that I've learned over the past 10 years so that you can capitalize on that. And then finally, I mentioned this as part of our sales process, but it only takes us about 30 minutes. If you give us annual revenue and expenses, how many clients you saw last year, and total number of sessions, we can tell you what your profit margin is, what the lifetime value of client is, what your profit per client is, how much a marketing agency can afford to spend to get you a new client without the business losing money. We do all of this for clients on our second call in a spreadsheet and share that with you so that you have all that information before you even get started. That way we know we're going to be successful before we even roll, before we even give you a marketing recommendation. So if you guys are interested, mentalhealthmarketing.com/promo. Just give me your info. I'll get you hooked up.
Thank you, Aaron. That sounds like a great program. Jeremy, at some point, professional work is good. Google changes its algorithm over 600 times a year. That's almost twice a day. So keeping up with that while you're trying to actually run your practice and see patients can be a very difficult task. So feel free to come take advantage of our people. Anyway, thank you.
Thanks, everybody.
Thank you.